Okay, so people are still coming in, but I might just kick us off with some admin to start up. So welcome everybody. My name is Sam McCann and I am the manager of the Wildlife Heroes project at the Foundation for National Parks and Wildlife. So I'm sure a lot of you have heard of this project before, but we support wildlife volunteers and wildlife vets across the country in their work. And in New South Wales, we are supported by the New South Wales Environmental Trust. So just a little bit of admin. So first of all, if you've been attending the National Parks wildlife webinars, which I'm sure a lot of you have been, you'll notice we're on a different platform today. So you usually use Teams. So well done getting onto Zoom today. But just in case anybody's confused, so if you're attending the webinar, your video and your microphone are automatically off. There's no option to turn them on. So if you're confused and you're worried that people can see you or hear you, they can't. You should just be able to see the panelists on your screen, and that is normal, so don't worry about that. What you should be able to see though is down the bottom. So if you move your mouse a little bit, you should be able to see the options at the bottom. You still have a chat box, which you're welcome to use to chat amongst yourselves. But tonight we also have a Q&A option. So you should see the little icon that says Q&A. And we're going to be using this tonight. So throughout the course of the webinar, if you have any questions about Q fever that you would like answered, please put them in this box. We do have a DD present. You can see it right now from National Parks, which a lot of people will know a DD. She'll be monitoring that Q&A box. So any questions you have, please pop them in there, and we should hopefully have time to get to those later on in the webinar. So just to be clear, if you have a question about Q fever, please don't put it in the chat, please put it in the Q&A box. The other thing to mention is also just that this webinar is being recorded. So if you need to leave early or if you know somebody who you think would benefit from the webinar, I'll be sending around a link afterwards. So keep an eye out for that, and we will have the webinar available on our website, the Wildlife Heroes website as well. So yeah, keep an eye out for that afterwards. So we might just get stuck into it. So thanks everybody for coming. It's great to see so many wildlife rehabilitators especially taking an interest in this topic. Q fever and the prevention of Q fever is so important, and I really hope today that we'll be able to address some of those questions and some of that information that you guys are after to really understand the disease and also to help people make informed health decisions too. So to do this, we have a wonderful panel assembled. I'm really excited about how much expertise about Q fever we have in the room tonight. So before we get into addressing people's questions, I'm just going to go around and get each of the panelists to introduce themselves and give us a little bit of a background about who they are, what they do, and the experience they have with Q fever. So to start this off, Stephen, I might go to you first.
Well, thank you, Sam. Can people hear me?
Yes.
Good. Okay, so I'm Stephen Graves. I'm a medical doctor and a PhD in microbiology as well. So I have a great interest in all things microbiological, but one of my special interests is Q fever. That's why I'm here tonight. But back in the mid-1990s, which is a long time ago now, I established the Australian Rickettsial Reference Laboratory to study rickettsial diseases in Australia. And at that time, Q fever was sort of a rickettsial disease because it was found in ticks. Now we know that it's not, but I'm still interested in Q fever, and my laboratory is a diagnostic laboratory as well. So we do diagnostic tests looking for antibodies in patient serum to Coxiella burnetti, the bacterium that causes Q fever. We do PCR tests on specimens such as heart valves and things like that, and ticks. And we also culture Coxiella burnetti. So we've got quite a big collection of Australian strains of Coxiella burnetti. So I have a very great interest in it, and I'm really looking forward to listening to what people have to ask about tonight and hoping to help.
Thanks for that, Stephen. I might move on to Peter next.
Thanks, Sam. So Peter Massey is my name. I'm coming to you from a Wawakul country, Lake Macquarie, and just pay respects to elders past, present, emerging in the country I'm on, and all the countries represented here today. I'm a nurse by trade. I work at the public health unit for Hunter, New England, and specialise in communicable disease control. Also have a doctorate in public health and researcher in Q fever and lots of other things. So Q fever is one of our many interests. I've worked for 30 years in regional more rural New South Wales, and Q fever is a hot issue amongst farmers and wildlife people in the New England area, where I've spent 20, 25, 30 years in that area. And so that I have on the ground experience talking to people who have Q fever, working out with them about where they probably got it, and also then I do using that information to advocate for better programs to reduce the risk of Q fever, provide training to GPs about Q fever and the vaccination program, and I work with the panelists on a whole bunch of things around One Health, including Q fever. And so it's great to be here with you tonight, and hope to be able to help out a little bit and answer your questions as we go along. So thanks, Sam.
Thanks for that, Peter. So we might go to Kate next.
Hello everyone, I'm Kate Bosworth, and I've been a vet for about 30 years now, and these days I work at the Sydney School of Veterinary Science at the University of Sydney, teaching vet students all about microbiology and zoonoses. And zoonoses are my favourite things, and of all the zoonoses, Q fever is my favourite zoonoses. And I work, Stephen's laughing at me, I work in animals, looking at all the sources of Q fever for humans, or Coxiella for humans, that gives them Q fever. So we've worked in cattle, sheep, goats, alpacas, dogs, cats, horses, and now wildlife. And I also research along with Stephen and Peter in the people that work with these animals to look at their exposure as well. I've been working in Q fever and Coxiella now for well over a decade, and I'm happy to answer any questions tonight about the animal sources along with my PhD student, Karen.
Thanks, Kate. And with that, we'll go to Karen. Whoop, you're just on mute, Karen.
Okay, so my name is Karen Matthews, and I'm Kate's PhD student, and I'm really interested in Q fever as well. So I've worked as a research assistant for many years, and I was working in Q fever before I started my PhD with Kate, and yeah, I've been working on it now for coming up to 4 years for PhD. I'm due to submit in February, and yeah, so I'll hopefully answer any of your questions you have tonight about wildlife and Q fever.
Oops. Thanks, Karen. And Shane, we're very lucky to have you here tonight as well. Would you mind giving us a bit of background about yourself?
Oh, thank you. I'm Shane Flanagan, Clinical Director of the Port Macquarie Koala Hospital for the last 22 years. And also I occasionally have to deal with kangaroos hit by cars and euthanizing them. So obviously I might get a few bodily fluids on me. And I also live on a property where there's cattle all around me. But in 2008, I came down with Q fever really badly. I was very sick for quite some time, didn't really recover for about 6 months, got over it, everything was fine. And then in 2013, 14, around Christmas time, I became very unwell again, and pathology indicated that it was a new infection again. And it wasn't as intense as the first time, but it was longer, and very unwell for a very long time, and I'm still not right, even after all these years. And an infectious diseases specialist said that I now have the chronic fatigue from Q fever, and I wouldn't wish it on anyone. So that's my story.
Thanks for that, Shane, and thanks so much for coming tonight and being willing to share that story with us as well. So I think that's all. You guys know Aditi. So I think to kick things off, we're just going to start quite broad. So Peter, I might go to you first. Could you please give us a brief overview of what exactly Q fever is and how can you get Q fever?
Sure. Are you able to share the screen or enable me to share the screen? Otherwise, I'm happy to talk without.
It should work now, I think.
Yep, not going to work at my end. Look at it.
No.
Not to worry. Let me just try that one more time. No, not to worry. I'll just talk about, I've got the slides in front of me. It's fine. So,
You're set.
if you could just look over my shoulder, you could see them. So Q fever is first recognised in Australia back in the 1930s, so even before Stephen was working. It was described in workers in Brisbane at a meat processing place who become ill with a fever. And then following on that, it's been found in many other countries, and probably every continent, I think, Stephen, except Antarctica and New Zealand. That's right.
That's what I know, yes.
Yeah. And so Q fever is caused by an organism a bit like a bacteria, and this bacteria lives in animals and has spores, sort of like seeds of the bacteria in soil. And you can breathe in the seeds of it, or you can get the direct type of bacteria infection from close contact with animals. So what sort of, so the bug that causes Q fever is called Coxiella burnetti, and it's named after the person who described it, or one of them who described the bug. When you go looking for Q fever, the bacteria that can cause Q fever, you can find it everywhere, and it's a very common thing. So most closely related or thought of is with sheep and goats and cattle, so livestock. And it's probably because more people have close contact with livestock than they do wildlife. If we farmed kangaroos would be on the top of or farmed kangaroos more, kangaroos would be on the top of the list. Or if we farmed deer more in Australia, deers would be on the top of the list. But because we farm sheep, goats and cattle a lot, that's a group that comes up often in that. But Kate will talk later, I think, about where the animals where we see it. But it definitely includes bandicoots and kangaroos and other animals that a lot of the carers might be have a closer link with. The bug itself is shed from the animal through their urine or their feces, but particularly their birth products and even their milk. So a classic for us when we're following up people who've had Q fever is that they've been doing an activity with the livestock that's put them up close and personal to the livestock, and the most riskiest interaction with the livestock seems to be the pulling calves. So if people have got cattle and they're calving, and the cows need a hand, putting your face up and close to the bum end of the cow is going to, while they're having a calf, it's going to, and they're infected, is going to cover you in the bacteria. But sometimes it can be quite minuscule contacts, or even from small animals that you may be in contact. And some people, it's probably just the dust from nearby farms with the spores that blow past. Thankfully, it's not hugely common disease, because half the people who get notified, it's pretty nasty. About half the people who we hear about with the lab confirmed Q fever end up in hospital. And they're in hospital for 4 to 6 days with that. In our little bit of the world, we get about 50 cases a year. There's around 400 cases a year across Australia. Most of that's concentrated in North and Northwest New South Wales and Southwest Queensland. That's where most of the notifications from. But you'll actually find this bacteria everywhere. And but the risk in the Western New South Wales, Northwest, North and Southwest Queensland is sort of Q fever capital in Australia. But as our friends in South Australia have found, it wasn't there, they thought, some years ago, but now is a common occurrence in South Australia. I'm not sure that it's been widely described in the Tasmania, but there's no reason why it's not there, and probably less frequent in the desert countries, but where there's just less animals, I presume. When we think about the people who get notified with the disease. So that's people sick enough to take themselves to a doctor, and then the doctors thought, oh, this could be Q fever, and does a blood test. For that group of people, where we see most of it, you think would be in the people in their young adulthood. In fact, it's the 50 and 60-year-olds who we see this disease the most. And of course, they're young. That's the age group I'm in. That's young adults as well, in their 50s and 60s. But that group, we see a lot of cases. And gee, you talk to any farmer or wildlife worker who's been in their 50s, who's been working on the farm or working with animals for 30 or 40 years, and they'd say, oh, I must have had Q fever before. Like, I'm not at risk because I've been a farming or I've been a wildlife handler for decades. Why would I get it? That's the group that seem to get it and get pretty crook, end up in hospital. So no matter what age you are, the Q fever is going to be a risk. We get some kids notified with it, but it increases as over their age groups. And most likely, as kids get older, they get more involved with direct contact with animals. So help involved in the rouseabout work and shearing, help mustering cattle, and then eventually more hands-on with the bigger stock and over time, and then risk increases. We hardly ever see Q fever now in abattoirs because they immunise against it, and the vaccine is fantastic. Stephen will talk about that a bit later. So what does Q fever look like when you get it? Well, for a lot of people, they might never know they've had it. They've had a headache and a bit of a fever, and it's just gone past as an illness that hasn't bothered them. But for many people, it's like a bad flu. So you get the aches and pains, you get the fever with it, and the chills. Some people talk about drenching sweats, so just soaked from the sweat. Really bad headache. Actually, it sounds like a bit like COVID. If you get these symptoms, make sure you get swabbed for COVID, because COVID's more likely than Q fever at the moment. But if you're COVID negative, then go for a Q fever. That muscle pains and joint pains are really bad, and really bad tiredness. I remember talking to one gun shearer, like he used to do hundreds of sheep in a day, and 3 months after his infection, he could only get the smoko. He'd probably only done 10 or 20 sheep, and that was it. The fatigue from it was quite long-lasting for him. Most people get better in 2 to 6 weeks. Nearly everybody, if you get notified, needs some time off work with it. And then if there's the chronic disease that also goes with Q fever. So about 10% of people end up with a chronic infection or chronic syndrome as a result of the infection. And that can include ongoing fatigue, but also damage to your heart, the heart valves. And Q fever can be quite nasty. Pneumonia and hepatitis are frequently part of the picture. And unfortunately, we lose some people from Q fever every year. A couple of people nationally die from Q fever. And in our patch of Australia, we have one person die from Q fever every 2 to 3 years that we're to get notified about. So I think Q fever, for some people, it's not much of a disease. For other people, it's a killer. And there's a lot of people where it's pretty nasty. And of course, you can't tell what you're going to be. And so we much rather prevent you getting it so that you don't end up on the nasty end of this disease. So who's at risk from this disease? It's people like yourselves with close contact with animals, as well as farmers and graziers, people who are transporting cattle, people working in meat works, and in and around shearing sheds. And some work that we've done testing blood samples from people who donate blood, so through the blood bank, we've shown that quite a number of people who don't have livestock exposure have also had Q fever in the past. So this disease isn't about in our areas, in your area. It's it comes to people from animals, like Kate's talking about, a zoonosis, we call it. For most people, it's just like flu-like illness, but it has a nasty edge for some, including hospital, heart damage, damage to your liver. And so that's on the bad side. On the good side, it's preventable. And so we'll talk about that in a little while. So that's just a bit of a thumbnail sketch of Q fever. And just to finish with, I think we call it Q fever because it was a query. Why are these men getting this fever illness in the abattoir? It was a query. And still all these years on, since 1930, we have people like Karen doing a PhD on Q fever because there's so much we don't know about this disease. But we do know some of the things, and that's just the ones I've outlined now. Hopefully you found that helpful.
Thanks, Peter. That was really great. It was a really good overview to start with. On the topic of symptoms, Shane, I'm wondering if you would mind just sharing with us what kind of symptoms you experienced. I know you said the second time it was a lot worse with the chronic fatigue, but the first time, I guess, what made you go to the doctor in the first place?
Makes me feel like a hypochondriac getting on. It started off exactly as Peter described, lots of shivering. And within 24 hours, I had a headache that you wouldn't believe. Temperature was hovering around 39, 40 for about 5 days. Couldn't eat and drenched in sweat, and ended up going to the outpatients on the Sunday morning. And thankfully, my doctor was on call, who has dealt a lot with Q fever, and he took one look at me, said, "Oh, I think you've got Q fever," and took bloods and sent me home. The only thing I don't understand is why he didn't put me on doxycycline once. Once they worked it out, which I'm really quite disappointed in. But anyway, look, that's the past and that's it. So yeah, a whole month of just really, really ill with just couldn't eat, nausea, exhausted. Getting from the bedroom to the bathroom was, a marathon. Went back to work part-time and it took me 6 months, but then I was right. But I've never, ever since then, I've never been able to eat anything spicy or oily. And every now and then my liver enzymes were going up. So, and then when I got the new infection in 2013-14, it wasn't as acute. I didn't have as many shivers and shakes. I still had high temperatures and headaches and nausea, but it was sort of like a slow climb. And it took me 2 years the second time to come back, and I lost a phenomenal amount of weight, and I'm a pretty skinny thing, so I can't afford to do that. And and now today, if I just overdo it, I just crash. That's it, just simply crash. And my liver enzymes are still not wonderful. So, but thankfully I don't have endocarditis. That's all been checked out. But yeah, it's horrible, and I would really, really recommend that everyone gets vaccinated. Really, definitely.
Thanks for that, Shane. We'll definitely focus a lot on vaccination a bit later. But first of all, because we have so many wildlife rehabilitators present tonight, I might go to Kate. We had a question that came in that said, in the event description, we wrote that wildlife rehabilitators are twice as likely to get Q fever as the general public. So first of all, how do we know this? And second of all, why is it that wildlife rehabilitators are at a higher risk than the general public?
I think Karen would be a good one to answer this because of one of the parts of her PhD. Would you like to talk about your serosurvey, Karen?
Yeah, so my PhD was sort of divided into 2 parts, if you like. So one was looking at the people to see exposure in the people and try and determine whether wildlife were a source of infection for people, and the other side was looking at the animal side of it. So in 2018, we conducted a serosurvey at the Australian Wildlife Rehabilitators Conference in Sydney. Some of you may have even been at that. So we measured exposure to Coxiella burnetti, the causative agent of Q fever, by taking some blood samples and getting them tested at Stephen's lab. And what we found that the rehabilitators at that conference, they had a seroprevalence of 6.1%. So that was a measure of exposure to Coxiella burnetti. And compared to healthy blood donors, it's 3.6%. So it's almost twice as high. So that's indicating that they're twice as likely to be exposed to the bacteria. Also found that 3 people in the cohort self-reported Q fever disease. So they said that actually had the disease, and that's much higher than what we find in the general Australian population. So they ended up being 2% in that cohort compared to 0.002%, which is what we find in the general Australian population. So that's how we know. But unfortunately, the source of the infection or the source of the exposure amongst those participants, it was not obvious. And I guess another thing to mention too is a lot of the notifications now, they cite exposure to wildlife or kangaroos or wallabies and no known exposure to traditional sources. So bearing that in mind as well. That's how
Yeah, that leads us nicely into the next question actually, which was, I've heard that kangaroos are most likely to give you Q fever, and I had this submitted a couple of times. So is this true, and are there any other particular species that are higher risk for giving you Q fever?
Karen's just frozen.
Oh no.
Just give her a minute.
I'm sure it'll come back.
Yeah. So Karen actually had there she is. She's back.
Yeah,
Karen.
sorry, I think the internet connection is a bit unstable here. So this was a question about the kangaroos
Yes.
most likely to give you Q fever. Okay, well, let me share my screen. So, share. Can everyone see this?
Great. Yes.
Yeah.
Yes.
Okay. So this is a summary of all the studies that have been done on kangaroos. Oh, it's missing a few bits and pieces.
Just click on
Oh,
it,
no.
isn't it?
Yeah, I might just have to use this one. Yeah. So this is the study, all the studies that have been done on wildlife. So as you can see here, the little icons are meaning. So these are antibody studies, and this little symbol here is DNA. So there's been a few studies that have been done on kangaroos and on different wildlife species, some done on ticks. And as you can see here, you know, some of them have shown that they've got antibodies, so it's indicating that the animals have been exposed to the bacteria. And some of them, they're finding DNA in the feces or urine. But there's never been any evidence of the animals actually shedding the bacteria. So as in ruminants or livestock where the bacteria multiply in the tissues and it's shed, it's unclear whether kangaroos and wildlife are behaving the same way as livestock do. So that comes to the next portion of my PhD, as I mentioned before, the animal side of things. So that's the other part of it. I'm actually looking in animals and kangaroos. I've looked in wombats, and I'm looking at koalas to see if I can actually find Coxiella in the tissues. So evidence of Coxiella growing within the kangaroo tissues. So I've sampled a variety of tissues. And yeah, that's ongoing at the moment. So at the moment, there's been no direct evidence that that the kangaroos are actually shedding. However, it's not saying that you can't be exposed to Coxiella via the wildlife, because you know, but they would be a much lesser source of infection than your traditional sources, such as ruminants. Kate, have you got anything to say on top of that?
Yeah, I guess the reason why ruminants would be the main source is, I don't know if those of you who have been involved and you've seen a calving or a lambing, they come out with a huge placenta. And the placenta, I think, would be the tissue that Coxiella burnetti loves the most. And some studies have said that in a gram of placenta from a cow, there's 1 billion Coxiellas potentially in that tissue in an infected cow. So if you think about how big a placenta is, and there's 1 billion per gram, that's a lot of Coxiella. And so that's, as Peter said, if you do a calving, that's why you're more likely to catch Q fever via that source. And it's in all the fluids and on the calf or the lamb. And of course, you know that, you all know way better than me that kangaroos and wombats and all of the wildlife species, they don't have those big, massive placentas, do they? You know, you think about how small a little kangaroo is when it comes out and goes into the pouch. So that source isn't probably a source for people from wildlife. But we know we've found it in feces. But whether that's just they've been co-grazing with cattle and they've inhaled it that way and it's just passing through, or whether they're actually amplifying it in the body, that's the exciting part we're trying to understand. And if they are a source, are they shedding it in their feces and we're inhaling it from where their feces have contaminated the environment? Is it in their urine? There's been one study that's shown a small number, I think it was one had in the urine. Is it coming from the urogenital tract of koalas, for example? This is the exciting part of Karen's project, because we'll find out what it is about wildlife that is a source. We already know heaps about it in livestock, makes perfect sense. But what is our wildlife a source and where is it coming from? That we don't understand very well. We'll get to the bottom of it.
Yeah, it sounds like we should hopefully have some more information soon.
Yep.
Maybe soon. Shane, I'm just wondering if you could jump in there for a second. Do you have any idea of where you think you got Q fever from? Do you deal only with wildlife, or is there a particular method that you think would have exposed you?
Probably 99% wildlife and a number of species. But as I said, I live on a property, there's cattle around me, and I've got an old house cow myself, and I live in a rural area. So who knows? I don't know. Yeah.
So Sam, can I just add something to that? So that's a really interesting point, because if those cattle and sheep, deliver a calf onto the soil and then they put those billions of organisms out there, as Peter said, they survive in that spore-like form for years even. So then they can be whipped up by the dust and you can inhale it. So this is the tricky part about it, why people sometimes don't know what their source was, because they've inhaled it from that contaminated environment, because it lasts for a very long time. It's not killed by heat and desiccation and UV light like lots of our bacteria are. So that's why it's sometimes very hard to work out where you got it from.
Yeah, thanks for that. We're having quite a few questions come through in the Q&A box too, and I might just ask some of those now, just while we're still on the topic of which species in particular we have evidence for. Somebody did ask, is there any evidence that it could be coming from bats? So I noticed, I don't think that bats were mentioned in that slide that you showed before, Karen, but have you heard anything about the relevance of bats?
No, I haven't heard anything about bats. Have you, Kate?
I think it was in Sarah Tose's paper. I think she looked at some bats. I just can't remember off the top, but it was a very, if it was, it's a very low source. It's not a major. One of the things that bats isn't the main blame for.
Yeah. Yeah, sure. The other question was also, do all animals, so for example, if it's really common with cows, is it most cows that are carrying Q fever and you're unlucky enough to then get it from them, or is it actually not that common within the animals?
And Stephen and Peter can chime in on this, but I think that if you hang around cattle for your lifetime and you're involved in birthing cattle and you're on a dairy farm, for example, that's buying in cattle and trading in cattle, sooner or later, your number's going to come up. And if you work in an abattoir and you're not vaccinated, sooner or later, your number will come up. In contrast, I think if you're working with wildlife, you might be lucky and get away with it. If you work with dogs and cats, as a dog and cat breeder, and with wildlife, much less likely to get it compared to working with livestock. But because the consequence is so nasty, you don't want to play Russian roulette.
Yeah, definitely. From Shane's recount, it definitely sounds like something that you don't want to be getting. So Steve,
I'll just add a little bit to Kate. Just an example is when I first started in infectious disease work, the cattle farmers would grow, and sheep would grow on their property, sell to the local market, go to the local abattoir, and the restocking was done locally. The industry has completely changed now. So cattle from northwest New South Wales will appear down in Adelaide the next day. Like, it's just a transport of cattle and sheep now over the countryside is huge. And so it could mean that if you, I had a friend who had just bred cattle on his place and sold off. Nothing ever came on. He didn't, he'd worked on it for ages. He wasn't going to get immunised because he thought he was managing his risk. I'm not so sure, because there was kangaroos around as well. But just the nature of the industry now, just the cattle or any livestock that's next door to you or on your place. That could have been anywhere. And so you bring that risk into your space. And so the world's changed in the last 20 years around agriculture, and the risk for Q fever has got bigger.
Thanks. Did anybody else want to add to that before we move on? All good. So Stephen, I might go to you next. So everybody has just started slightly mentioning vaccination. So I think that's a really important thing for us to talk about. So I've had questions about what's the best way to protect myself against Q fever. So obviously that leads us straight into the vaccination conversation. Would you mind giving a bit of an overview about the vaccinations against Q fever? So I know they're a little bit different to your standard vaccination. We've had questions about getting tested for antibodies and needing a skin test. Would you mind just giving an overview of that process?
Certainly, Sam. Well, it is a novel vaccine, and it's somewhat different to all the other vaccines that we use in Australia, in that it's not safe to give it to people who've already been exposed to Coxiella burnetti. Now, of course, most people don't know if they've been exposed to Coxiella burnetti or not. So before the doctor gives the vaccine, they have to test the patient to see whether there's any evidence that they've been previously exposed. And they do this by two ways. They take a blood sample and look for antibodies to Coxiella burnetti. And then they do a skin test. They inject a little bit of the bacterium into the patient's skin and examine it again a week later. And if there's any reactive lymphocytes or red blood cells in that patient that are reacted to the Coxiella burnetti injected, there'll be a little lump in the patient's skin. So the doctor tests for a little lump in the skin. So if there's any antibodies or there's any lump, that patient's already been exposed to Q fever. We can assume that they're probably already immune, and it's actually dangerous to give them the vaccine. So doctors don't give the vaccine to those people because they can have a nasty reaction to it. However, if you come back with no antibodies and no skin reaction, and certainly if you're at risk of Q fever, and I think probably everyone on the webinar tonight would be at risk of Q fever, I strongly recommend you have the vaccine because it is a very effective vaccine. It's one of the most effective, about 95% efficacy. I only know of about a dozen people that have actually got Q fever after being vaccinated. So that's how effective it is. Much better than the vaccine for COVID-19 at the moment. But it's been used in Australia since 1989, so we've got many decades of experience. It's only used in Australia, funnily enough. It's made by a local company in Melbourne called Seqirus, which is owned by CSL. It's called QVax, quite a good name really, QVax. It's not on the public. It's not on the benefits schedule. You can't get it. You can't get it just by the pharmaceutical benefit scheme. Is what I'm trying to say. So you have to pay for it. So the doctor gives you a prescription, and you go to the chemist and you buy the vaccine. Take it back to the doctor, and the doctor gives you an injection, or you buy it from the doctor if they've got it in their refrigerator. But the doctors have to buy it. It's about, I think it's a little bit over $100 now. So it's not a cheap vaccine. And that's because it's so expensive to make. So companies don't make vaccines to lose money, of course. They like to make a little bit of money. So they are making money on it, but they don't, it's not like a lot of the other vaccines that are publicly funded by the government or quite cheap to make. So the take-home message, Sam, to everybody who deals with wildlife is please get vaccinated. The doctor will have to test you first to see whether it's safe to vaccinate you. But if you are vaccinated, pardon me, if it is safe to vaccinate you, please have the vaccine because it can save you an awful lot of heartache, trauma, pain and misery. And have you heard the story that Shane's told us? So that's not an uncommon story.
Thanks, Stephen. We've had quite a few questions about getting vaccinated. So first of all, are there common side effects from the vaccine?
Common side effects from the vaccine are a little bit of pain at the injection site, a little bit of swelling, and they're probably about 20% of people will get those. Then a much smaller percentage will feel a little bit unwell, might have a bit of a fever and feel a bit lethargic. Usually people are back to normal within 1 to 2 days. So it's really no worse than the ordinary vaccinations for other diseases if you fit into that category of being able to receive the vaccine. If a mistake is made and a person gets the vaccine who shouldn't get the vaccine, they can get quite nasty reactions. So you really must have that preliminary testing of the skin test and the blood test.
Thanks, Stephen. And another question was also, if I had the Q fever vaccination 8 to 9 years ago, do I need to get another one, or am I now immune to the disease?
It appears that the vaccine lasts for a very, very long time. This might be because people are being exposed in the field to the real organism, so it's boosting their immune status. But we never give the vaccine a second time to anyone because they're already partially immune, so they could have a bad reaction to the vaccine. So you never have this vaccine twice. Once is enough.
Great, thanks, Stephen. I might also go to Peter now. So I had a question, can you get Q fever twice? And I know this is an interesting question to discuss, especially with Shane present, because it seems that Shane has had Q fever twice. So would you mind talking a little bit more on this?
Sure, I'd rather not get it once, but it's nothing's 100% in health and medicine, and so you could get it twice. Often we've seen with people who've diagnosed the second time is maybe they weren't diagnosed right the first time or diagnosed right the second time. The diagnosis is a bit tricky, but I guess nothing's impossible. That person could get it. And then there's the other aspect that I mentioned about a chronic disease, and you get a chronic infection. So you might have had it first and then the infection, and then have gone on to have some more complications from an ongoing infection with this. So the disease can be nasty. The vaccine, I saw one of the questions, though, is safe. So that if you have the vaccine, your body's immune system gets on top of the vaccine and leaves you with good levels of immunity, and the vaccine itself doesn't hang about in the body. You're just left with the immunity. So, and it's, as Stephen said, it's fantastic vaccine. We've looked at all the Q fever cases in Australia. I did a project around that and found only a tiny little number of people who'd been vaccinated. Some of them got Q fever because they got vaccinated one day and then they were put into slaughter floor at the abattoir the next day. And so they weren't immune because it takes a couple of weeks, just like COVID vaccine, takes a couple of weeks to kick in, the same as a Q fever vaccine. So some of them weren't really vaccinated cases. There was a small number. And of course, when you have a Q fever vaccine, it's not everybody has it. You only have it if you're going to be in contact with animals. So for a vaccine that works so well on people who are at the highest risk is just amazing. We hope in the future, Stephen's working on another vaccine that we mightn't need to do the testing beforehand, and that'll be a different construct. It's not available yet, or in the year, but hopefully next 10 years, we might have a better vaccine. Stephen, we've got to drag this out a bit to keep us in the job for a bit longer. But we hope to have a better vaccine in the future. But the current one is really good.
That leads me to another question nicely, actually. Stephen, I had a question that in your bio, so we sent out a little blurb about yourself in the webinar invite, and it did mention that you were developing a new Q fever vaccine. So why is this needed, and like what exactly is that going to add on top of the current vaccine? And also, how long do you think until it's available?
Well, there are a lot of questions and also quite a few unknowns there.
Yeah.
But essentially, QVax, the vaccine we have at the moment, is the whole bacterium killed. So it's the whole bacterium. So it's got the important molecules in it and a lot of unimportant molecules. And it's probably the unimportant molecules that cause the bad reactions. So the vaccine I'm developing is called a subunit vaccine. So it only has the part of the bacterium that's important for developing immunity. And it doesn't have all the other things. So we're not expecting patients to have to be tested for antibodies and skin tests beforehand. We're expecting it to be a jab and go vaccine. You come into the doctor, you say, I'd like to have the vaccine against Q fever because I'm at risk or I live in a rural regional area and the wind's blowing a lot, or whatever the reason, you get the vaccine and no preliminary testing has to be done. So it'll be like all the other vaccines. Now, it won't be any better than QVax. That was almost an impossibility because QVax is such a good vaccine. If it's as good as QVax, I'll be very happy. But what I do think it will be is it'll save a lot of angst and a lot of trouble and a lot of hassles because you won't have to do all the preliminary testing.
Yeah, that sounds great. And it's definitely something that can be a struggle if you live in rural areas and you need to then go into your doctor, you know, over the course of a couple of weeks, getting the different tests. I'm sure it'll be so much more accessible if it's just one jab.
Sometimes it takes 3 visits to the doctor. The first visit, they do one test, and the next visit they do the next one, and then the doctor has to buy in the vaccine, or the patient has to get the vaccine and go back to the doctor. It puts people off, especially if people are in the rural areas and they've got to drive 50 kilometres to the nearest doctor. And not all doctors do it because it's so complicated. You can find a doctor who says, "Oh no, sorry, I don't do that," because it's just a big hassle. So our research is still in the animal stage where we're testing it in animals. I'm hoping we'll get it into a phase 1 human study in 12 to 18 months, where we actually test it for safety in humans. We just do that on a very small number of people, obviously, to make sure it's safe. It's certainly safe in guinea pigs, but it has to be tested in humans before it can be wound out. And then it'll take quite a few years to actually test its efficacy, because you'll test it in an area where there's quite a lot of endemic Q fever, and you'll do every second person will get the vaccine and the alternate person will get a placebo, and then you'll follow them in time and see whether there's fewer cases of Q fever in the people that got the vaccine. So in 5 to 10 years, we'll be able to say, yes, it's a good vaccine, it works well, or sorry, Stephen, it's no good.
But for now, QVax is great and people should get it.
I strongly recommend you get QVax if you live in a rural regional area or have anything to do with any type of animal, but your doctor must test you first. That's really important.
Yeah,
on the
definitely.
vaccine safety, if I can just jump in there, Steve and I are also involved in a project looking at vaccine safety for teenagers. So the vaccine itself is just licensed from 15 years and above, but there's no physical reason why it's not safe under that. So we're involved with a national study looking at the vaccine safety for 12 to 15-year-olds, and was it 10 to 15? I can't remember now, in that younger high school age group. And we expect that it'll be completely safe, and it'll be able to be available, and that'll be good for wildlife carers, because I know a lot of carers start when they're teenagers, of course, and so to be able to provide some protection early on in their life would be a wonderful thing.
Yes, I think it will be safe. The reason it was only licensed for 16 and over, because it was developed by the late Professor Barry Marmion for use in the industry, the meat industry. And so they never tested it on younger people. And if you don't test it on younger people, the authorities won't authorise it for use. So you've got to test it on the people you want to use it on. So it was only tested on older people, and that's why it's restricted. But I've actually given it to my children who were younger. I think they were 8 and 9 at the time, no problem. And I've given it to quite a few other children as well. It's off-label effectively, but if they're at risk, if they're on a farm where the cattle have got Q fever, it's much better to give them the vaccine and try and protect them. So I'm certain the vaccine is perfectly okay in children. You just have to pre-test them the way you do with an adult.
Yeah, sure. I might go to Kate, just because we spoke a little bit about this the other day, but I've had questions about if I don't have the vaccine, are there other ways to protect myself as a wildlife rehabilitator? So are there either physical barriers or different behaviours that you can use to try and avoid Q fever?
Okay, well, I guess to be able to explain that, you need to understand how you get it. And it's thought that the most common way is and the most efficient way is by inhaling it. It goes down into your lungs, gets taken up by some cells down in your lungs. So what you've got to do is avoid inhaling it. So a P2 mask that fits properly, not just any P2 mask from Bunnings, it must fit and there can't be any leaks. Right? So that would be the way that you would stop yourself inhaling it. But when we were talking the other day, I told you a story, didn't I, that made me sort of, well, I guess, illustrated why that is not foolproof. And there was an outbreak in a veterinary hospital in Sydney, and I think it was about 10, 12 years ago now. And it involved a cat that came in for a cesarean because she was having trouble delivering her kittens. She came in at 8 o'clock in the morning, and she had the cesarean straight away, and she was gone from the vet hospital by midday. And she infected 9 people. And some of the people that were infected weren't even present on the day she was there. Those people came in the next day. So that Coxiella, that bacterium, floated around in the air, and there have been studies that say that it survives for 2 weeks in the air. Okay, so maybe it survives longer even than that, but that's what that one study said. So if you're relying on that P2 mask to protect you, you kind of have to keep wearing it if you're in an enclosed space that's been contaminated. And of course you can't see that the air's been contaminated. So there are some people who can't get vaccinated. And if that's the case, and you can't get vaccinated, and it's not because you've had it before and you think you're immune, then you would be wise to wear a P2 mask. But you have to keep it on. And everybody who's wearing them now associated with COVID knows how unpleasant that can be on a hot day. So that's why the vaccination is, that's why all of us are saying the vaccination, because trying to stop yourself from inhaling it, you know, for example, if you look after koalas like Shane does, and you've got to collect their browse, right, to feed on, you've got to go out into the bush to collect those, and there could have been some livestock around that area, and the ground's contaminated, or they're in neighbouring paddocks and you're inhaling it that way. You're not going to want to walk out there doing that day in, day out with your P2 mask on. And one thing Karen found in her study, the survey that she asked the people that had positive antibody for, again, you know, had shown they've been exposed, that 6%. One thing, those people did a lot of things to do with animals. Their potential exposures were wildlife, but they were also, if there was a calving going, they were involved in that, their cousin's property, they had dogs, they had cats, they went visiting, you know, they went hiking out in the bush where there was potentially contamination, you know. So if you think about all the things you do where you could be exposed, are you going to wear a P2 mask every time you do that? No, you're not going to want to do that. So if you can get vaccinated, getting vaccinated is the safest way and the most complete way to protect yourself all the time. As well as that though, you should always remember all the other things like washing your hands, covering open cuts and wounds. So you can tell I say this to the students all the time, it's just coming out, isn't it? Wearing protective outer clothing that you wash in the washing machine, and remembering the person that does the washing needs to be vaccinated as well. All of those things, disinfecting, all of those other infection control things, because there's things that wildlife have like salmonella and other things that you can catch. So having really good hygiene when you're around animals are really important as well. But the vaccine for Q fever is the most important one. And Stephen and Peter might want to add to that.
No, you've made the case very well. It really is. It is the best way to get protected. And if you can't be vaccinated for one reason or another, then you run a much higher risk of getting Q fever if you're working with animals, or even if you just live in rural and regional parts of Australia. We've seen 50% of new cases of Q fever now have no actual contact with animals that they can recognise. So it's blowing in the wind.
On the topic of being able to get vaccinated, we've had a couple of questions about whether the vaccine's safe if you have an autoimmune disease. I'm not sure if, Stephen, you would know the answer to that.
I think that would have to be an individual question for an individual patient, because it will depend on what the autoimmune disease is, what level of immunosuppression their doctor's giving them to keep that autoimmune disease under control. And it may be safe, but it may not be effective, because if the immune system is being damped down to keep the patient's autoimmune disease under control, the immune system may not react properly to the vaccine. So that can only be answered on a patient-to-patient basis, sorry.
Yeah, thanks for that. And assuming that person's present, it sounds like you might need to just speak to your own doctor and get that answer. Another one we had on getting vaccinated, and I think we've kind of already brought home the message that everybody should get vaccinated, but it was that Q fever seems to be more prevalent in the tropical areas, in the warmer areas, and if somebody lives in a cool climate area, do they still need to get vaccinated? I'm assuming the answer is yes, but I'll just throw that to you, Stephen.
Well, yes, the incidence in Queensland is greater than the incidence in New South Wales, which is greater than the incidence in Victoria, which is greater than the incidence in Tasmania. So it does appear to correlate with latitude, but there are lots of other variables. The density of animals, the wind, the direction of the wind, there's all sorts of things. And Q fever occurs all over the world in rural communities, even in you know, quite cold places. So I don't know that it's just that. It's probably related to the number of Coxiella burnetti floating around in the air from the animals that are infected. How many animals are infected, for example? Probably if you're living in Tasmania, it's not a big risk. I've only heard of a few cases in Tasmania, and they were actually associated with cattle that have been imported from mainland Australia. Peter was talking about the fact that the cattle are moved around a lot nowadays from place to place. And so this was an imported illness. You're on mute, I think.
Thank you. We might just move a bit more into the diagnosis of Q fever. So we've had quite a few people, Peter, I'm going to direct this one at you just so you're ready. So we've had quite a few people ask, is Q fever something that would be routinely tested for if somebody went to their GP with, you know, flu symptoms? And in that vein, I might just read out another question that we had sent in from somebody that's kind of in a similar topic. So this question comes from an attendee who has had a personal experience with tetanus and found that hospital staff were not equipped with the knowledge or the equipment to diagnose and treat her illness. Their question was, what steps are being taken to ensure that doctors are trained to recognise and treat Q fever, as well as ensure that public health units are stocked with the appropriate medical supplies and diagnostic services required to treat it?
Great, yeah, nice bunch of questions. So Stephen and I keen on this. Thanks for somebody who said about they like our enthusiasm. Q fever is fascinating and so important that we do some stuff about. But Stephen and I did a paper helping to lead GPs to better ways of diagnosis and management of Q fever. We're just about to update it again, and the diagnosis includes a blood test. So most of the notifications we get are people who've had a serological test. So you get a blood test and it tests your immune response to the bacteria. That's prompted by symptoms that look like Q fever that can't easily be explained. So a person comes in, the GP, they say, oh, look, doc, I've got this drenching sweats and I feel a headache and I'm feeling rotten and what's wrong with me? And the doctor goes through some bits and pieces. This time of year, it's not going to have influenza. We have no influenza around. Check that they don't have COVID. Hopefully the GP says, oh, do you have any contact with animals or live in a regional area or rural area? Tick, tick, oh, it could be Q fever. Stephen and I would prefer that they actually test for Brucella, lepto and Q fever at the same time, but definitely Q fever if they've got some contact with animals. We've had clusters of lepto around other animals, so that's a point that Kate was saying. We can prevent Q fever. You've got to do other things for other diseases. So test for the immune response to those diseases. But if you've just got sick, actively sick with that fever illness, your immune system hasn't kicked in yet. So actually we need you to come back in 2 weeks' time and to get a second blood test. And then your immune markers will go up. And then we'll say, that definitely was Q fever. Hopefully, at that first visit, unlike Shane, the doctor says, here's some treatment. I reckon it's Q fever. While we wait on the second blood test, take this doxycycline for 2 weeks, and that'll get you better. And so we have good treatment for Q fever if it's diagnosed. If people with a cough and a fever illness get given penicillin, it's not going to work. It's a specific treatment, easy to get, but it's specific treatment. So they're to enable hospitals and doctors to do better. I think Zoonosis is, we're involved in education. So I know of hospital doctors and GPs and specialists. Stephen and I and Kate over the years have done a lot of work with vets and human health practitioners on this, and we continue to do, and including CSL or Sequirus, the company that Stephen mentioned, have got a good set of videos starring the Dr. Graves, who appears in these little videos and outlines stuff about Q fever and diagnosis as part of the GP learning. In addition, there's a package on the GP training system called ACRM and RACGP that we've been involved in the development of. So there's some things in there. Doesn't mean it gets done, but we keep trying and to bring the awareness up in rural and regional practitioners, as well as both in human and animal health areas, as well as where we can in the rural medical schools. We provide that in the undergraduate training. So that the diagnosis, actually, let me go back to diagnosis. We did look for the immune markers. The other fancy test we have is looking for the PCR test, it's called, or looking for the DNA, or actually testing for the bug itself. So when you get a COVID swab at the moment up your nose, and that's a PCR test, it's looking for the DNA of the virus. Similar technology we use on the blood, and to work out if the bug is in the blood. And it's really helpful if you've got that's acute illness, because we can find it in that and help get a shorter diagnosis, and then reduces the risk of the person not coming back for their second blood test. So we've got some good blood tests with a good set of clinical symptoms that look for exposures to look for, and so there's really no reason why we don't diagnose it more. But I think one of the questions we've had is about how common is it? Well, it's way more common than we get notified for, because people don't turn up to the doctor's, oh, I'll just wait it out, take some Panadol and wait it out. Or the doctor doesn't think Q fever, or that doesn't do the right tests, or the person doesn't come back for the second test. So there's all things that slices off the notifications, and we only end up with a little bit. But that little bit shows for us that it's an important issue.
I guess that's a really good take home for the people that are here tonight, that if they are, if they do have symptoms and they think I actually could have Q fever, to mention to their doctor that they have a high exposure to animals, because I guess that'll just help hurry that process along.
Yes, I think that's very important, Sam. If you work with animals, any species of animal, and you get a fever, muscle aches and pains and a headache, whether you've got any breathing difficulties or not, mention that to the doctor and say, could it be Q fever? The doctor won't mind you prompting him or her, because there's so many things that can be, and even the best doctor forgets one of the differential diagnoses from time to time. Like tetanus, for example. Tetanus is so rare that doctors don't ever see a case. I have only in my whole life, I've only ever seen one case of tetanus. So when things are very rare, you just don't think of them. And Q fever, unfortunately, fits into that category for doctors who've come from city medical schools and work just starting to work out in rural areas. So yes, by all means, say, could it be Q fever? And then that'll prompt the doctor to think of other zoonoses or animal transmitted diseases, like Peter's mentioned, like leptospirosis or brucellosis with people that hunt pigs and things like that. So don't be shy in coming forward. If you're wrong, your doctor will tell you, no, it can't be.
Shane, I'm actually wondering what your experience with that was. So like when you presented to the doctor, was Q fever something that was tested for straight away? How exactly did your diagnosis come about?
This first time or second time?
Yeah, well, both.
The first time I rocked up at our local outpatients, and it was just fortunate my doctor was on call, and he took one look at me and he said, oh my goodness, and then said, I think you've got Q fever. No, he knows, that I work with wildlife and whatever. That's when he did bloods and voila, yeah.
Sounds like that was a very lucky experience for you. I mean, actually, in general, not, but at least you had a fast diagnosis, I guess. So we have around 25 minutes left. So I think I'm going to go to the Q&A chat box just to make sure that we're touching on the things that people really want to hear about. So one of the first questions we've got here is, so I think maybe Peter mentioned before that they test blood bank samples to look at the prevalence of Q fever, I guess, in people. And I know that Karen also looked at blood samples from wildlife rehabilitators. So if you're sampling from the blood bank, will you then advise the blood donors that they have Q fever or that they've been exposed to Q fever, or is that all anonymous?
Yes, we would, but it was just a research project to answer the question, should the blood bank do this? And the answer was no, because there wasn't, we didn't find people with active illness. We definitely found a lot of people with the immune markers of the disease, so they've had it in the past. So the blood bank haven't included this as an active screening because they answered the question of, well, we tested thousands of people and there was no active cases amongst it. So from the blood bank's point of view, their blood supply is safe. From our point of view, we're able to test for the immune markers and see what the hell, where did all these people get Q fever from? So that was a bit of a shock for us. So so there was the two parts to that. So yep, that's enough of that story.
Thanks, Peter.
I'd like to add something to that, Sam.
Yeah.
People can get exposed to Coxiella burnetti and actually develop antibodies in their blood, so it'll be picked up later, and they actually don't actually have an illness. It's very strange. It's what we call asymptomatic seroconversion. So we find those people, and then you ask them, have you ever been ill with Q fever, or have you ever had an illness like that? And they can't remember it. So there are some people who actually do have antibodies in their blood but haven't had obvious Q fever, but they have been exposed to the bacterium.
Yeah, sure. Karen, with the wildlife rehabilitators, was anybody in that study? Did they find out they had Q fever through your testing? I think you said 3 people had it.
Yeah, so 3 people reported that they'd been medically diagnosed with Q fever.
Yeah.
And the ones who were seropositive, so that's the ones who had antibodies against it, I sent out the results to them. But as Stephen said, they may not have necessarily had Q fever because they may have, who knows, they could have had it and hadn't been picked up, or they might have just been asymptomatic. So, yeah.
I guess that saves them having to get a skin test. They already know that they can't get the vaccine now.
Yeah, I think they'd probably still need a skin test, wouldn't they?
If they're antibody positive, we don't bother doing the skin test. Usually most doctors do them simultaneously.
Yeah.
Would they be able to use my results that I sent them, or would they still have to go
done in a
through?
reputable laboratory?
It certainly was. I guess I sent them a letter that we both wrote. So
yes,
yeah.
Yes, I know. Yes, the answer is yes. They could use that. They could use that result, and that person would then not be able to have the Q fever vaccine because they'd be assumed to be already immune.
Okay.
Yeah, sure. So some other questions we've got in the chat box. So we do have a couple of species ones still. Do any birds carry it? Karen, you might be able to answer that one. I know that I think the general message before was we don't really know. But yeah, any evidence about birds?
Yeah, I think there's been evidence in seabirds. Is that right, Stephen?
Yes, there have been isolates of Coxiella burnetti from birds, including the ticks on birds.
Yeah, that's right. Yeah,
they're often the tick species that don't bite humans, so we don't think that's part of the human cycle. But I suppose if it's being excreted in the bird feces,
exposure that way,
possibility you could inhale it. I don't think anybody studied that.
It was birds that were found, particularly birds around livestock, were more likely.
Yes, that's a good point. Yeah. The cattle egret, for example.
I was just about to say that.
Were you?
Birds that hang around cows, yeah. Okay, thanks for that. Another question probably for you, Stephen, is can an infected human pass it on to another human?
Well, the answer is really no. There have been a couple of cases. There have been some reported cases of sexual transmission from husband to wife. And there was a very interesting case where a lady gave birth to a baby in hospital and they didn't know that she had Q fever, and the obstetrician and the theatre staff got infected with Q fever. So it can happen, but it's not the normal way it happens. So normally if someone in your family's got Q fever, you don't have to worry about getting it from them. However, you could get it from the same source that they've got it from. So if there's an infected dog or cat in the family, you might find 3 people in the same family getting it, one after the other, but they haven't got it from each other. They've got it from the same infected cat.
Yeah, definitely. Okay, next one is, not sure if this might be Stephen or Peter, but I'm allergic to tetracyclines, including doxycycline. Are there any other treatment options available?
Yes, I'll take that one. There are. Doxycycline is the best drug, but people can't take it, and people do have reactions to it. There are others like rifampicin, chloramphenicol, azithromycin. So just tell your doctor, what you're allergic to, as you always should do anyway, so you don't inadvertently get the wrong medication. And then they can nearly always find another one. And there are experts the doctors can phone up to get advice on, what antibiotics are used for this particular patient.
Thanks for that, Stephen. We have an interesting question here. If your dog likes eating lots of kangaroo poo, is this high risk? I would imagine they're thinking that the kangaroo poo could give it to the dog and the dog would give it to you. Would this be something that could happen?
Yeah, Kate.
Yeah, Kate?
So, as I said before, inhalation is the most common route by far by which you get it. So if there was Coxiella in the poo and they were eating it and snuffling it while they're eating it, then they could potentially inhale it just like they could from the air around. Ingestion, so one of the reasons why we pasteurize milk to such a high temperature, 68 degrees, is to kill Coxiella actually, because it's so heat resistant. But it's not, there have been a few papers which have suggested that people have got it from drinking milk, or that people have seroconverted, developed antibody to it from drinking milk, but it's not very common that people get it from eating things. The much more common route you get it is through inhaling it. So it's more about inhaling things. So I guess if they're eating kangaroo poo and that kangaroo poo has Coxiella in it, they're probably more likely to get it because it's probably aerosolized. If, say, you mow over the top of that poo or something like that, they're more likely to inhale it. But can I just say the next thing is that what we call parturient dogs and cats, so that's dogs that are desexed and aren't giving birth, there's no evidence to show that they're a source of infection for people at all. All the dog and cat exposures are all associated with ones giving birth. So your average pet dog and cat is not likely to be a source. But if they're giving birth, you could be unlucky.
So you probably won't get it from your dog licking your mouth.
You can get a whole range of other things.
Probably
like
don't do that anyway.
Campylobacter.
Not recommended.
Not recommended. Okay, next in the chat box, we've got, do vets and vet nurses get routinely vaccinated for Q fever? I'm not sure who would want to jump in and answer this one.
Probably Peter. I don't know the answer to that question.
Kate seems to know.
Kate, she's at uni.
Yeah.
So we used to run vaccination days for our first year vets, but now we just say you need to come vaccinated or you don't come. Right. So absolutely, unless the only people who can come into vet school that aren't vaccinated, there's a very good reason why they can't be, usually because they're positive on one of those tests when they're screened. So almost all vets now under the age of 50 have been vaccinated because that's when the vaccine first came in. Older vets, there's still some older vets around that aren't vaccinated, and they've probably had Q fever, many of them. Now, vet nurse is a totally different thing, and I had a PhD student a few years ago, Emily Sellon, who did a study on this, and whereas 75% of vets were vaccinated, only a third of vet nurses were. And of the ones that hadn't been, probably about 40 or 50% had never heard of Q fever, didn't even know there was a vaccine, didn't even know that they were at risk. And many of those work with small animals, dogs and cats. And so because livestock are the more commonly known one, they weren't aware that they were at risk, but because they're exposed to caesareans and whelpings and queenings and kittenings and those sorts of things, they're at much greater risk than most people around dogs and cats. So if you're a vet nurse and you're not vaccinated, you absolutely should do, because the TAFEs don't do it the way the vet schools do.
Mm.
And then, Kate, it was worse again with the with the animal handlers, wasn't it? So there was even a lower level.
Yeah. And receptionists. So remember, receptionists are breathing that same airspace. The person who does the washing in the practice, the person that comes in on Saturday morning and does the cleaning, they're still breathing the same air. They all have to be done. And, you know, we've seen abattoirs be prosecuted for not vaccinating people for Q fever, and Peter and Stephen can attest to that. And some of the abattoirs have had very big 6-figure fines for not vaccinating their staff that have got Q fever. We're not at that point yet, I don't think, in the veterinary industry, but I think we'll probably come close to it pretty soon.
Mm.
I'd like to just add to that as well. In my Sero survey, I had quite a few vet nurses there that weren't vaccinated too. I can't remember the number off the top of my head, but it was alarming that they weren't as well. So yeah, if you're a vet nurse, go get yourself vaccinated. In fact, if you're a wildlife carer, just go get yourself vaccinated.
An employer has to provide a safe workplace. So if a workplace puts an employee at risk, any type of risk, that's actually illegal. So if you can actually prevent it by vaccination, you've got to. So there have been some employers fined quite considerable amounts of money when their employees got Q fever and they hadn't offered them vaccination beforehand.
And Peter here, just on the vaccines also would be tax deductible if you're an employee and you pay for it yourself, or if you're working for a foundation, for example. And you get, there's a small income, you can offset it with tax deductible. But I do understand that most wildlife carers, it's going to be voluntary and it's just going to lay out the money. Then if you're doing that, just think of it as a good investment rather than a cost, because you're investing in your health. And the vaccine lasts, especially if you're a young wildlife carer. You're going to get decades and decades out of this. The vaccine is really good.
Mm. Speaking of, I guess, vet nurses not even knowing what Q fever was, Shane, I'm interested to know, before you got Q fever, did you have an awareness of what Q fever was?
Most definitely. I used to work in the cattle industry way back in the dim past, so certainly knew about it, but going into wildlife, of course, I didn't think it was an issue. Yeah, but as soon as my doctor said, I think you've got Q fever, I knew straight away. So yeah, my fault for not getting vaccinated. And incidentally, at the koala hospital now, we are trying very hard to vaccinate all staff that work closely with koalas if they're dealing in rescues and whatever, or you know, right in the system. We're trying to get everyone vaccinated, because we've had three of our staff have had Q fever at the koala hospital, and also in the other wildlife group in our region, there's 3 people that have got it. So yeah, we're on a campaign to try and get everyone vaccinated. So.
And Sam, wildlife carers are named in the Australian Immunisation Handbook as among those who are at risk and should be vaccinated. So every doctor's got access to that. And if they go to a doctor, they can, and they say, I'm not sure if you should, they can easily Google it, find that, and they're in there along with all the livestock people and the dog and cat breeders. They're all named in there as being those that should be vaccinated.
Yeah, it's so important that we get this communication out there, because I'm sure so many people just don't realise that link with wildlife, or have just not heard of Q fever before. I had not heard of it before I became the project manager for Wildlife Heroes. So yeah, it's definitely something that we need to get information about out there. So Another question we have, which might go to Peter, I think, is there a QVax register for people who have had the vaccination?
Yes and no is the answer. So there is a Q Fever register. It's based in Queensland, I think. The idea was to be a national register, so, and mainly for abattoir workers. So if you're working up at Mackay, you can have your vaccine there, and then you think, oh, I'm sick of living there. I'll come down, live in Inverell and New South Wales, and your vaccine would be recorded and easily shown from workplace to workplace. That was the idea. In reality, it hasn't quite worked that well. So, it works that well for some people, but lots of people have had the Q Fever vaccine. It's not on there. You can, and a lot of employers don't access it as well. A safety net was to be the Australian Immunisation Register. We don't have Q Fever yet listed on that, but we keep advocating for that to happen. So really, you just got to keep a record. So next to your COVID record on your phone, you have a Q Fever record with you. It is a good way, especially if you're moving between care groups or move from the coast into the bush, and you can prove that you're vaccinated. Really, you need to keep your own proof, not rely on the register. There is some information in the register. It's a bit helpful, but it's not a great safety net.
Could I add something to that? I don't want to get political, but I think it's important to say that people have been trying to advocate to the federal government to include Q Fever vaccination on the whole of life vaccination record that everybody has now. There's a lot of vaccines for older people, like, varicella zoster, shingles vaccine, the pneumococcal vaccine. So they now boast that everybody in Australia's got a whole of life record of vaccination, but it doesn't include Q Fever. It's actually, the register is run by a meat company. The Australian Meat Processing Company runs the register. It should be a job for the government, along with all the other vaccines. I'll get off my soapbox now.
Thanks, Stephen. Aditi, I saw that you would like to pop in with a question.
Yeah, thanks, Sam.
No worries.
Brilliant panel. Thanks, everyone. I was going to ask to the panel, but I've been chatting to Kate about this around disinfection. So some practical things that wildlife rehabilitators could do in terms of disinfection, hygiene, keeping everything clean.
So this is interesting because I had a student had to do a project on this. She came and saw me. She said, I have to do a research and inquiry project. What do you want to know an answer to? And I said, I want to know what disinfectants, what do we know about disinfectants and Coxiella? So she went back through all the literature and found all the literature and put it all together. And so it turns out that there hasn't been a lot done on disinfecting of Coxiella because it's a hard bug to grow and you can only grow it in certain conditions because it's dangerous. But whatever you use, you need to use it for a long period of time, so 30 minutes. So if you're using 70% alcohol or bleach or the quaternary ammonium ones, they will work, but you need to use it for a long time because you remember you can't kill it by heat and you need really hot temperatures and it doesn't dry out. It's designed to survive for a long period of time out there in the environment. So you need to apply your disinfectant. You just can't use it for a minute or two. You really need to use it for up to 30 minutes. So yeah, you need to be quite thorough with your cleaning. You need to get rid of all the fecal material and all the organic matter because things will survive in there. Make sure it's scrupulously clean. And if you're going to apply your low concentration of bleach, you need to make sure it's for quite a while to kill it. That was the answer she came up with, which surprised me because I thought a much shorter period of time would kill it, but that's what the evidence shows. Now, if you use it for a shorter period of time, you will kill some of it, but not all of it. So there you go.
Hey, Peter, what about ventilation in where carers are looking after animals on the inside or in a shed or a garage or something around that, or vets surgeries, for example? How do you think ventilation might help reduce risk as well?
Yeah, well, we're all about ventilation at the moment with COVID, aren't we? It's really topical and Yeah, so I think lots of the new vet hospitals that get built now are purpose-built to really enclose air spaces and then have HEPA filters to clear out the air. So they're a lot safer, but perhaps some of the old established vet clinics or some of the old places where you might be looking after your animals might not have those fancy HEPA filters. And so you need to make sure that you do have good ventilation, which is opening windows. You could use air purifiers because they work very well as there's more and more literature coming out at the moment. So even just an air purifier is a good way. So remember, it's in the air, survives a long time in the air, and you inhale it. So things like air purifiers would be useful if you've got an enclosed space where you think could have been contaminated with a birthing or something like that.
I'd like to just hop in here if I can. It's also really important to think about how you're managing when you're cleaning your enclosures and cages and things like that, because you're generating dust that you could be inhaling while you're doing that. So trying to minimize the amount of dust, and obviously wearing a mask when you're cleaning enclosures and doing things like that. And also thinking about how you're burying animals that may have been deceased, and yeah, how you're handling your compost and things like that, because any wind that blows or any generation of dust is going to increase your chance if the dust is contaminated.
Yeah, thanks for that, guys. We are actually getting really close to the end of the webinar. There's a couple of more questions in the Q&A, but I might actually just follow up when I email everybody after the webinar. I'll just follow up with a couple of those answers just to make sure that we get all of the information out there. But before we end, I just wanted to check with the panelists if there was anything else that they wanted to raise that they thought was really important for wildlife rehabilitators to hear tonight. Just chuck a hand up if you have anything to say.
Get vaccinated.
Get vaccinated.
Yeah. I think that's the take home, isn't it?
Yeah, get vaccinated.
Yeah. I did also want to say, so we did have a couple of questions about subsidies for vaccinations for wildlife carers. So if you don't know already, Wildlife Heroes, unfortunately this is for New South Wales groups only, but we are currently offering vaccination grants for Q fever vaccinations to licensed wildlife rehabilitation groups in New South Wales. So if you're part of a New South Wales rehabilitation group and you don't think that your group has applied for this grant, feel free to bring that up with your group members, with your president. I know a lot of the New South Wales groups have already applied for the grant, which is really great to see. And we do have some more money sitting there. So if people use up all of the vaccinations that they've got, they can apply for more money again. So yeah, if you think that you're in a group that hasn't applied for this, please let your group know. And you can find more information about that on the Wildlife Heroes website, wildlifeheroes.org.au in the grants section. So I think we might leave it there. Thank you so much to all of the panelists. It was so amazing to have such expertise about Q fever in the room tonight. And I'm sure everybody attending is really thankful that we got to hear so much amazing information tonight. So thank you to all of you. Thanks to everybody that attended as well. It was amazing to see so many wildlife rehabilitators get involved. Yeah, and yeah, I will be sending around the link as well. So if you want to pass this webinar on to anyone you think that it would be important for, and we really encourage that too. I think as far out as we can get this information, the better. So definitely we'll put it up on our website. Please feel free to share that around. Aditi, I'll just get you to pop in for a second. I know you had some information about another upcoming webinar that you wanted to share.
Yeah, I might send that through in email actually, Sam. It's all good.
Okay.
Thanks.
Okay, no worries. Yeah, when I send through that follow-up email to everyone, I'll also include some more Q fever resources. So there'll be some more information available there and some answers to any of the questions that we didn't quite get to tonight. But I'm sure everyone's ready to go have some dinner. So thank you again to everybody. This has been so great. I'm really appreciative of everybody that came tonight. Yeah, I really hope this got through to people. So thanks. Have a good night, everybody.
Thank you.
Bye.
See ya.
Bye.